Sahar, can you see my slides? Okay, just gonna make it full screen. See it now still? Okay.
It's not full screen, but we can see your slides.
Okay, fine. I'll figure it out. Okay, so Kamran, why don't we get started? So first of all, thank you, Kamran, for hosting this one, and welcome everybody. I want to welcome you to the fourth of our workshops on entrepreneurship, entitled So You Want to Be an Entrepreneur. The reason we took on this was because we noticed that there's been a sea change in the interest in entrepreneurship in the Department of Surgery. In fact, a sea change probably everywhere in academic medicine in entrepreneurship and commercialization. And if you compare our past to our present, you know, in the distant past, we had the occasional entrepreneur, but now we number approximately 70 individuals within our department who are doing some sort of entrepreneurship. The ecosystem a generation ago was quite minimal, and I think that you know, all of us here on the panel are part of the University of Toronto, and I think again we would see that it's broadly embedded across the University of Toronto. Incubators, networking, mentorship, etc. The role of the department was very modest in the past, but now I think we, including with this type of workshop, we've increased the profile. We have a job description that's called Surgeon Entrepreneur. We have integrated into our training program and have increased the visibility across the department. And I think finally, in terms of scholarship and promotion, it used to be unclear whether or not you could have an academic career in the area of entrepreneurship. And while it's probably not crystal clear quite yet, it's pretty clear that if you are doing something that's impactful in this area, it's really the platform for academic promotion. We've had, this is the fourth of four, as I indicated. They're going to be a total of about 60 minutes, and it's a moderated discussion by Kamran Khan. The idea is to attract, to identify and engage residents and faculty within our department, to showcase what's on here at the University of Toronto and also what's on in our Department of Surgery, and perhaps to highlight what happens here in Toronto. I call it the Toronto Advantage. This is the fourth, as I said. You can see previously we had a kickoff one with Paul Walker, who was the moderator. In February, we had one that was chaired by Dr. John Semple on digital platforms and applications. In May, we had one chaired by Shaf Kashavji on regenerative medicine. And this one, we were lucky to have a great panelist, a great set of panelists, but also a great chair. Many of you will know Kamran Khan already. He will be the chair of this. Kamran's a professor of medicine here at the University of Toronto in the Division of Infectious Disease, but he's also a clinician scientist. And I think that his maybe his grounding goes to a period when he was focused totally on being a clinician scientist. But many of you will know of his fame with Blue Dot, and in particular, those who are junkies for 60 Minutes will have seen it presented previously on the 60 Minutes program. So I'm going to turn it over to you, Kamran, to adjudicate the proceedings, and look forward to the presentations and the questions from the people who are in attendance. So thank you, Kamran, and thanks everybody on the panel.
Thanks, Ori, for that important intro, and just want to thank our three panelists. I'll just give a brief intro of you know, a bit of a bio of each of our three panelists, and also just thank everyone for coming to today's session. Ultimately, we want to keep this pretty informal. As Ori mentioned, the ecosystem and kind of the pathway for entrepreneurship in academia has evolved a significant amount over the last several years. I know certainly when I founded Blue Dot 9 years ago, it was definitely a little less clear. You know, I think in many ways, I wish I had had the opportunity to talk to other entrepreneurs and kind of learn from others. But as we build up this community, you know, this is an opportunity for us to be sharing some of our experiences and insights. So, so that's ultimately what today's session is going to be about. Let me just introduce our three panelists, I'll start out with Tomi Poutanen. Tomi is a serial entrepreneur who has founded and sold previous companies. Layer 6, I believe, was the first company that he founded. He was the chief AI officer at TD Bank, was a co-founder of the Vector Institute, and then more recently is the founder of Signal One. And Tomi has a background in computer science and also as an investor. So I think he brings a really a unique perspective to today's discussion. I'm going to go over and talk a little bit about friend and colleague, Teodor Grantcharov. Teodor and I have known each other for quite some time, shared patients on the wards together, and Teodor has been a real leader in quality improvement and quality care in the field of surgery, is the founder and CEO of Surgical Solutions, which created the OR Black Box. Teodor is currently, as you can see, perhaps from his background, sorry, as I said that, Siri decided that I was asking it a question, and is currently at Stanford. And so we're really grateful to have Teodor here to share some of his experiences. Also, just wanted to thank Fahad Razak. I can tell from your scrubs, Fahad, and I think the last time I was over at the hospital, you're attending on the internal medicine consult service right now, I take it. So thank you so much for joining. Just a little bit about Fahad. Fahad is an internist at St. Mike's and was one of the scientific directors of the COVID-19 Science Table. You've probably read a lot about Fahad's comments in the media. But maybe more important to today's conversation, Fahad is the co-founder of Gemini, which is I'll let him speak to it, but I think a really important collaborative amongst hospitals that captures in Ontario, I believe it's around 2/3 of all of the inpatient hospital data, and it creates an incredible opportunity for data analytics and insights to inform, quality of care, best practices, and so forth. So let me just, pause and thank all of our panelists for joining. Really appreciate it today. So I think what I'm going to do next is two of our panelists do have to drop off a little bit early. This is perhaps maybe one of the lessons about entrepreneurship, is things kind of come up sometimes unexpectedly. You've got an important meeting or a business deal to go to. So I know Teodor and Tomi will have to drop off at 6. So I think I'm going to just, modify the agenda slightly. Perhaps what I could do is I could have each of you, I paraphrased a little bit about your background, but perhaps maybe just to introduce yourself, a little bit about your venture, whether it's commercial or non-commercial. And perhaps maybe even, what was the inspiration for taking that leap of faith and, going down the entrepreneurial path. So maybe we could start there. To everyone else in the audience, just give some thought to some questions that you might have. I'm going to start to open it up shortly for Q&A from the audience, and we'll just go there and keep it pretty informal. So maybe, why don't I start out with Teodor? I'm just wondering, maybe Teodor, you're the closest to this cohort of surgeon entrepreneurs. Maybe you could share a little bit about your experience in taking that leap of faith, and maybe what were some of the motivating factors, but what were perhaps some of the things that might have given you a little bit of pause before going down this, this uncharted path?
Yeah, great. Thank you, Cam, and really, really nice to see Ori and obviously you, Cam. You both have had a huge impact on my work in Toronto. Ori obviously recruited me to U of T and St. Michael's 16 years ago. And Cam, you probably don't know it. We haven't spoken much about it, but you were probably one of the very few people at the hospital and university who gave me this initial push and inspiration to create surgical safety technologies a few years ago. And I remember at that point there was no structured opportunities like this one to learn from each other. There were not many companies that clinicians, scientists had started in the city, and I think growing that ecosystem organically has obviously helped me a lot, but also I'm pretty sure it helped many other people along the way. So I think we discussed a little bit about clinician, scientist, and entrepreneur, and there is a little perception that these are different type of individuals. And for me, this is part of the same cycle. I've been a clinician scientist for over 20 years, and I remember driving home one day. After the most recent publication, I felt that there was something not completely satisfactory in this cycle, from raising or generating an idea for research study, raising money through grant funding to complete the study, executing the study, publishing the results, and starting from the beginning. I felt that there was something missing, which was the most important part, bringing it to the world. And at that point, I was tired of knocking on doors of device manufacturers or third parties who could make my research a reality. So I thought there's no one better than me to bring it to the world, and that's how Surgical Safety Technologies was born. So I feel that we need to encourage clinician scientists or clinicians to pursue scientific career, and those who successfully execute that career find a way to bring their research work to the real world through commercialization or entrepreneurship. Obviously, there are other pathways to getting there, but this was a pathway that inspired me, still inspires me. It gives me this feeling that my research matters, and the implementation of my research is in my hands and the hands of colleagues around me. So I'll stop here, and really excited to be part of the discussion.
Yeah, thanks, Teodor. It's certainly interesting. I think perhaps a common trait amongst entrepreneurs is just being, a pragmatist, and ultimately figuring out, how do you get from an idea to implementation of the idea. I actually think that, if my memory is correct, I think it was Guy Kawasaki that, is his famous quote of that, ideas are easy, it's the implementation that's hard. And so just curious, on that initial path, you talked about what a motivating factor was there something, and again, thank you for the kind words. I do recall many of our conversations at the very beginning. It was sort of a go, no go kind of moment. And I'm just wondering, what were perhaps some of the things that gave you pause, that you might have kind of thought, well, is this the right thing for me? When I think about people in the audience, perhaps maybe they're aspiring entrepreneurs, they're contemplating it. And so on one hand, they might understand what may be a motivating factor, but they may also have certain, things in their head about, what might be a deterrent or a disincentive for them to take this path.
Yeah, I mean, I think all of us have some doubt. Are we good enough? We spend all our lives preparing to be doctors, and then years of our lives preparing to be scientists, and suddenly we jump into a different opportunity. And there will be a lot of voices who will say, also some of our inner voices that will doubt, are we good enough? Should we be doing this? We don't have proper training, we don't have experience. And I always say the same advice to people who ask advice for me, who are in this early stage and ask me for advice. And I say that there is no one better than the founder, the inventor, the scientist, who should be responsible for the growth, of course, surrounding with the right advice and expertise. But I think probably the thing that gave me sleepless nights was, am I good enough to do it? What are the practical aspects? At that point, hospital, university didn't necessarily see entrepreneurship as an asset, but often as a liability. How can I convince people around me that this is a good thing for all of us and for the organization? So obviously the environment has changed, the world has changed. Nobody asks that anymore, and the fact that we're having a conversation like this today confirms that. The fact that the university is recognize entrepreneurship as a good path to academic promotion is a massive advantage. But these were some of the things that were questionable for me, and I'm happy that I took the jump, and really lucky that I had the example around me. So I think it's our obligation now to share this experience with all of our colleagues and those who want to pursue similar path, and hopefully make this transition easier and from a practical point of view.
Great. Thanks, Teodor, for those comments. And yeah, certainly, I mean, you know, we're often extremely successful in our fields, but we're all subject to imposter syndrome, especially if we're in a new area and perhaps it's something that we don't have a lot of experience in business and commercialization. So appreciate those comments. Tomi, maybe I can come over to you now if that works. And you know, Tomi, you come from a background in computer scientists. I'll let you share a little bit about your background, but perhaps after you do that, I was just thinking a little bit about a similar question. But you know, does the computer science world, does it sort of look at commercialization through a slightly different lens? Perhaps in healthcare, we have this somewhat uncomfortable tension about, you know, profit and purpose. But maybe I'll turn it over to you to just share, share with the group a bit about your background, and then perhaps you can share a little bit about your experiences getting a company started and what motivated you.
Sure. I think I'm the biggest imposter in the room. I'm the only one who's not a clinician. And it's wonderful to see a program like this really to encourage entrepreneurship within the University of Toronto Medical School. Listen, Signal One is actually my 8th company. My whole life has been about building companies. I'm a computer scientist and really focused on AI and data. My career took me from University of Toronto to Silicon Valley, where I built some of the first machine learning systems, then back to Toronto to found a company called Layer 6. I see Jahir is on the audience here. He was a machine learning scientist there, and really one of, I would say, Canada's leading AI R&D lab. That was acquired by TD Bank, where I then spent 4 years leading TD's AI efforts. Along the way, I founded the Vector Institute with Professor Jeffrey Hinton. I founded a AI first investment firm by the name of Radical Ventures. I was one of the first fellows at the Creative Destruction Lab. And within the CDL, I funded CDL Health, which is a stream specifically to incubate health startups. And there was motivation around all of it. There was, we saw University Avenue and other healthcare institutions, research institutions in the GTA area were punching above their weight when it came to medical research, but very little entrepreneurship, commercialization was happening. And throughout, my wife is a clinician. She's an infectious disease doctor at Mount Sinai. So dinner time conversations are very much around healthcare and my view around AI's impact in medicine, and how the sad reality is that the hype was exceeding the reality. Everyone was talking about AI in medicine, but nobody was doing it. And after my career in building machine learning systems, both for consumer tech companies in the West Coast, to now bringing AI into a regulated space in banking, I had wanted to do something in healthcare for a long, long time. But I knew that it was going to be hard. Anybody trying to do anything in the healthcare system, there's a saying that 95% of healthcare startups fail. So that's a big failure rate. And largely, I think they failed because the system isn't motivated to change. So certainly one of the things that pandemic brought forward was a motivation to change. So for the first time in a long time, there was a window of opportunity where new solutions were needed to meet the crisis. And around this time, Ori and Mohammed Mabani came to my office at Layer 6, and they said, hey, we've got this AI developed at St. Michael's Hospital. It's helping us manage through the pandemic. It's good. It's saving lives. We've been trying to, being a good Canadian public institution, we've been trying to give our AI for free to other hospitals, but you can't just take an AI model built in one place, throw it over the fence, and expect another hospital to be able to make use of it. You really need a for-profit company to be able to pick up the phone, provide 24/7, do the integration into workflows, et cetera. So I remember, Ori, that conversation very well. And with that came a very gracious offer to stand up an independent company to do that. And that was the opportunity I'd been looking for. And that was the right partner. It was the right use case. It was the right time. And so that was really the motivation for Signal One, which is basically takes a lot of the AI models built at St. Michael's Hospital and distributes and commercializes that. In addition to partnering with St. Mike's and Unity Health, we've also partnered with TD Bank, and TD Bank was amazing in supporting the initiative. They've provided a license to the AI engine that powers the bank and the engine that I'd spent 10 years building. And so Signal One was going to set up with two really strong partners, providing Signal One access to a clinical partner and also a technology partner that's kind of now driving, just gave us a running start at the problem.
Great. Thanks, Tomi, for sharing some of your perspectives there. I was taken by one thing that you said, which is a statistic I'm familiar with, which is that 95% of healthcare startups fail. And as you were saying that, I was thinking, I bet you 95% of the people on this panel have not failed in their academic career. In order to become a surgeon or a professor or, an internist, et cetera. When we're looking at folks who may want to go down an entrepreneurial pathway, I suspect that there's a long history of success, getting straight A's and being top of your class and so forth. But now we're kind of asking people to take a leap of faith and go into another environment where the risk of failure is extremely high. I'm just curious if you think that might be part of the challenge. You talked about, we have this incredible discovery in one of the top universities in the world, a lot of them incredible academic output, but very little of that historically, and it's changing, but certainly proportionately there's a lot less commercialization than perhaps at Stanford or other institutions. So I'm just wondering what your thoughts are as a non-clinician. What's kind of holding us back in healthcare? Is it a cultural thing? Is it just that the healthcare system is, ossified and kind of likes to do things the way it always has? What do you see as perhaps an important barrier or lesson for all of us?
Well, there certainly is a cultural thing. In the U.S., there's no such thing as failure. If you go and pursue an entrepreneurial path and you fail, that's viewed as a positive. You had the guts to go for it, and you learned a ton of lessons. So you're actually more marketable coming out of that effort, and people have great respect for that. I think in Canada, that's maybe a little bit built into our psyche that failure is not an option, especially for this cohort of clinicians, surgeon scientists who've gone through 30 years of school and have never failed in their life. The thought of failure is a big blocker that would prevent somebody from even trying. And I would just put it to you that I think not trying, you guarantee failure by not trying, and trying, you will learn so much more and develop so much more that it actually opens up a whole bunch of different avenues. So even if it's a failure, you're going to be exposing yourself to a whole bunch of other opportunities that will, set you up for success in the future. Even if it's a failure within a health provider, they'll see your initiatives as being something that shows leadership and an initiative that then set you up for promotion. Even if it's a failure, you will develop yourself as an individual, as a leader, as a thinker in ways that you would never imagine if you just stayed in a clinical service. So I think there is this still this national, uniquely Canadian thing where we kind of shun failure or talking about it. Frankly, if you're in Silicon Valley and you're in tech, you celebrate it, you laugh about it, you talk about the lessons you've learned. So that's certainly, I think a mind shift that people have to embrace as they're looking at this path of entrepreneurship. But the other thing I would say that, anybody with skills as a clinician, it's not I wouldn't say it has to be a binary decision of leaving everything behind to pursue an entrepreneurial path. Usually if it's a healthcare startup, the clinician founder usually keeps their affiliation with the hospital or the university, and that provides them credibility and frankly access to the system. Even so much of the sales motions are based around credibility through academic publications, notoriety you get through academic conferences, speaking engagements, and you're much more credible as an academic speaking to other academics and building out those networks than if you were simply somebody on the commercial side of things. So as an investor, as I look at healthcare companies, I always, if there's a clinician founder, I will encourage that clinician to keep their practice in order for them to continue to stay engaged and have that credibility while being partnered with complementary co-founders that can run the business, that can build the business. So for a clinician, you're actually de-risking your stakes by continuing to maintain your position in your profession.
Tomi, there's a lot of things you said there that I think were profound. I'm going to just maybe highlight a couple of them because, number one was, I think, how we define failure and success. I will say, I think in some ways what might have influenced me was I did some of my postgraduate training in Boston and New York, and I did see a bit more of an entrepreneurial culture. I did see risk-taking and people starting companies and so forth. And so I think that might have had a bit of an influence. And when we think about failure, in some ways, I've kind of thought about it more like a randomized clinical trial, which is, did you have an outcome that was that there's an effect, or did you basically have, the absence of a particular effect? Now, one is neither a failure, it's ultimately you've learned something in the process and you can decide, okay, well, maybe this is not a particular path that we need to pursue now. We'll kind of go down this particular path. So I think of the entrepreneurial pathway as being one that is iterative, where there's new data points that come up along the way and you continue to iterate on those. So, but I do think that there's probably a significant cultural dimension to failure. And even in the academic promotion, in that particular arena, we might think that a failed venture might somehow inhibit or, be a headwind for our academic promotion. So I think there are more pathways. I was just actually doing reviews of people on their academic career paths and promotions. And so there is a section now for creative professional activity, and some list some of their, their ventures and so forth. So I think there certainly is a path there, but I think our mindset is perhaps maybe one of the biggest barriers to getting started. I'm going to thank you for that. I'm going to go over now to Fahad. Again, thank you, Fahad, for joining. I'm assuming you're on the wards right now with your scrubs. Is that fair?
I am. I'm in my office, but freshly off the wards. Yeah.
So, freshly off the wards. Yeah. Okay, perfect. All right. So a little bit of a sense of calm and being a bit more relaxed coming off of the service. So Fahad, maybe you could say a little bit about kind of your, a little bit about your background, perhaps about Gemini. I think what's interesting and unique is that Gemini is a pretty incredible innovation, and not just in Ontario, but I think a model for where healthcare can and should be going. But you've chosen well, maybe it's chosen or it's kind of been chosen based on the model, a non-profit path. It's a non-commercial venture, still a venture, you know, it's entrepreneurial work that you're doing. You're certainly, you know, pioneering new ground, but just wondering if you could kind of share a little bit about what that experience has been like for you. What are some of the challenges that you faced in that model? Maybe what are some of the benefits of you know, pursuing that particular path with Gemini? So I'll turn it over to you.
Yeah, so thanks for the opportunity to be on this panel. And, you know, wow, I would say you've heard the word imposter, but I think as I describe what we've done, everyone will realize that we're very early stages in terms of what we're trying to achieve with Gemini compared to Teodor and Tomi, who have really just built so much. So I'm at a different career stage than Kamran and Teodor as well. So maybe a lot closer to the trainees who are on this call. I'm just completed my early career phase. So I just transitioned to being an associate professor this year. So that first 5 years completed, and building Gemini has been the major work of the start of my career, and also Amal Verma, who's an internist at St. Mike's, who I think Tomi knows really well. So I'll say that as Kamran. So just to start, I would describe as what we did as entrepreneurial, but we are certainly not entrepreneurs. This is not a business, but it has had demands in terms of innovation, sustainability that I think many businesses face. So we are just approaching 40 full-time employees for Gemini, and those are real employees with real salaries. So those are, you know, 15 to 20 of those are data scientists who are, you know, 1 to 5 years, or sometimes a little bit longer, up to 10 years outside of their PhDs, who are competing to retain against TD and healthcare startups and other places. So we have a big payroll that we need to manage and raise funds continuously to pay these people. And we have complex partnerships with government, with hospitals. We have a lot of grant funding streams through CHR and Heart and Stroke and other places. So we've had to develop a lot of what a business has. We have someone who manages human resources. We have people who manage finances, someone to manage our data team. So I think a lot of the demands of having a business, and I'll tell you more about our work in a second, but very firmly in a non-business model because of, I think, certain demands and constraints that are placed within the space in which we operate. So what is Gemini? As all of you know, when patients are admitted to hospital, enormous amounts of data are generated as part of routine care. Lab work is sent, medications are ordered, vital signs are taken. There's a lot of metadata. There's the rooms they're sitting in, who did the ordering, what time the ordering was done, when a patient was transferred. For any admission to a surgical ward or a medical ward, or any ward in a hospital, we're talking about many, many thousands of data points that are just generated. And historically, they've sat there and not been accessible for analytics or analysis. The goal of Gemini was to see if we could harness that data and start to use it for secondary applications to help understand the care that's being provided, to drive research questions and AI applications, to help with system sustainability. It's taken a long time to build this model for it to work. So we started focusing at just 7 Toronto area hospitals, part of the U of T academic networks. About 6 years ago, we developed very crude models for getting this data out. We don't use the electronic health record by and large, because as all of you know, there's different electronic health records at different hospitals. So we've really focused on back-end data systems going directly to lab systems or medication systems. The data is messy, it's not standardized. There's a lot of elbow work. I'm actually an engineer originally by training before I went into medicine. So a lot of this kind of grind work of engineering, I think, was a lot of our work those first 5 years. But slowly and surely, we've built a model that has worked better and better. We have now expanded over the last 3 years to cover about 35 hospitals, covering all of the large academic hospitals in the province, plus most of the large community hospitals. Our data is updated, not in real time, because again, there's real system barriers to that, but we're trying to get towards a kind of a 3-month lag to getting our data updated. And we currently hold approaching 2 million patient admissions and many, many billions and billions of data points, because as I said, it's essentially every single data point about those patients as they're admitted. The data is not consented. this starts to get to the point of discussing why this is a not a for-profit model. So as we were building this model out, we were looking at other models globally, and for example, what happened in the UK with Google and DeepMind, and also practically thinking about what would happen if we were taking non-consented data from patients and using it for commercial applications. And without passing judgment on whether this is appropriate or not, culturally, I think in the Canadian system, using data for commercial applications that's non-consented is not considered by many people to be acceptable. That's the system we exist in. So we wanted to work within that system. Hospitals historically have not shared this kind of data, and so a lot of this was trust building. And so we have very explicitly taken a non-commercial approach to the use of this data and the applications of this data and what people can apply to us to do. It has allowed us to circumvent a lot of the IP fights which have traditionally prevented this kind of data sharing from occurring. So when we're dealing with big partners in the system, a UHN, the Ottawa Hospital, London Health Sciences, if there is a worry that by giving us their data on millions and millions of data points on hundreds of thousands of patients, that they're going to lose IP-related applications, they're going to be very unlikely to share data. And they're not compelled to share. The government doesn't force them to share. No one compels them to share. So it just takes a VP or a CEO thinking that they're going to be losing something to shut off the taps for a model like this working. So we've intentionally chosen a model which doesn't have that threat to them. So they still have their own IP and they can do whatever they want. Gemini itself will not claim IP on the data and the models that we build out. That has limitations. So how do you raise money when you're not when you don't hold IP? Well, you have to go through other streams. So we have to show that the data is valuable for research. And right now, for example, we have 14 CIHR grants that are running off of Gemini, that have combined operating budgets in the multi-million dollars funded off of Gemini data. We don't lead all of those. We have to show people at other hospitals that they can use our data for value for research. Otherwise, if you try and hold all that value internally, again, with partners that are not compelled to share data, it's easy for them to shut off the data streams if they don't feel that they're getting value. We had to demonstrate value to government. So we had to say there's a huge amount of inefficiency in a system where there's prior. So if I tell the motivational story for how Gemini started, it was really very understandable to all the clinicians in the room. We were at a physician retreat at St. Michael's that had 15 internal medicine doctors. We wanted to improve quality of care. This was 7 years ago. And we asked, it was my first year joining staff. I was a clinical associate fellow at that point. And I just asked, can we find out how many of our patients died last year? I'm on staff. I'd like to know how many of my patients died last year and if I did worse or better than my colleagues so I could realize if I'm doing an okay job. I had the anxieties that many of you will feel in your first couple of years on staff. And the answer was no. You can't find that out. There was no data system available that would allow a doctor to know how many of their patients died last year, or how many were readmitted, or how many had complications, or if I was using more MRIs than my colleagues. So that kind of information gap is striking to anyone. The rest of my family, I'm the only physician in my family. The rest of my family is in finance and in engineering. And when I told them that, they were shocked because none of the rest of the world operates in that way. You can't have a law firm and not know what your billable hours are. You can't run a finance company and not know what your bottom line is. But in medicine, we accepted that you could exist in these structures where you're doing extremely complex tasks to care for people. There's a lot of variability, but nobody knows who's doing well and who's not doing well. And that was acceptable. And so that was actually the motivation for us starting. And part of what we did early in our growth about year 3 or year 4 is we took some of our analytics to government and we said, we can start to help physicians understand this. We can allow each individual physician in the system to have really detailed, very easy to use data-driven reports, interactive, that they could click through and get a lot of granular information about their care and allow them to compare themselves against their colleagues and understand where there's opportunities to improve or where they're doing potentially better and share that story with their colleagues and explain how they've achieved better outcomes. And so the government started supporting us to generate these reports and to roll them out. The pandemic hit. Pandemic threw a lot of the healthcare system into disarray. And rather than giving information to physicians about the care they were providing, again, we had to become entrepreneurial and say, while hospitals are under these enormous pressures, reporting of MRI use is not important. Caring for COVID and thinking about an overrun hospital in Lombardy, Italy, and what happened in New York City, that's what people care about right now in 2020, 2021, as these waves of disease were coming in. So suddenly we shifted our operations towards helping a lot with COVID. And because we had something built, we produced the first and largest sample and research study about what COVID hospitalizations look like in Canada. We did the largest study in Canada around what critical drug shortages were occurring. There was some of the therapeutics for COVID Canada ran out of. So tocilizumab as an example, we had to start rationing it. So Gemini generated the first estimate of what that rationing was looking like, an ethical framework for how to allocate it out. There was a lot of worry about people with disabilities and other marginalized populations that were disproportionately affected by COVID. Gemini produced the largest analysis of patients with disability who were hospitalized. So we've rapidly shifted towards health system demands. And that's part of kind of an entrepreneurial mindset where you're not just able to operate off of research funds. You have to, when you have that many staff and that large an operation, you have to look for opportunities where you're able to support the system or add value. So that's sort of a story of how we've grown over the years. It's been a partnership. So my wife jokes that I have a spouse and then I have a mole who's my work spouse. And so we both have young families. We both each have 2 children under the age of 5. We've had to develop a model where we have to trade off of each other to keep the wheels turning, to raise money, to keep our, as we joke, our horse and pony show running, and take government meetings or research meetings as we continue to grow. So that's been part of the critical part of partnership. And the final part I'll say is it's not all rosy. So Ori knows that in the last week, I've had the good fortune of a lot of my mentors in research advancement and career advancement recognize the value of building something like Gemini, but it's not pure research. It's a lot of what we've built is infrastructure. And for the first time in a serious evaluation as part of a salary award, received a really harsh review of the work that we've done and said, what you've built is infrastructure. That's not science. It's not valuable as a scientist. So there's still many people out there that'll say, if you're a clinician scientist, you're doing this kind of work, well, you're not really doing science. What you're doing is not valuable as a scientist. And so the mindset of this having value, certainly I would say 95% of the people who have mentored me and evaluated my work over the time have been extraordinarily positive. But there's people out there who will say that this kind of work is not traditionally of value in the system where we have certain metrics for what is valuable.
Fahad, thank you. Gosh, a lot of really valuable insights there. I will say I'm struck by several parallels to, the more of the commercial side, the for-profit side of an entrepreneurial path. One is you're constantly in fundraising mode. That doesn't change. Even if you're at a Series A or B, you're always talking to investors and thinking about where the next source of capital may be coming from and building those relationships. I think the other was, thinking about scaling up, and certainly, now as you're at 40 full-time people, building an organization and doing it in a way where you can play to your strengths and others can play to theirs. But it's challenging. And I think some of the stresses that you've highlighted on yourself and your families and so forth, these are very familiar, I'm sure, to others on the panel. And I think the last was really just adapting to market demands and the market shifts. And on one hand, not necessarily, I think one of the things I learned was don't pursue customers, pursue markets, so that you don't get caught by one customer that takes you off. And this is not a repeatable thing. But certainly shifting and then generating value in the midst of a crisis is definitely familiar. I will just say to Ori, maybe this is something we should take note of as he talked about academic reviews and that many of them are far more conventional and traditional. These could be some of the headwinds that make the barrier to entry a bit higher for those who may be thinking about not an either or, not completely quitting their day job. They went into medicine or surgery because this is what they're passionate about, but ultimately to have some role in an entrepreneurial venture. So I am mindful of time. What I'd like to do is open it up to the floor for comments and questions. I know a couple of our panelists will have to jump in about 10, 12 minutes or so. Why don't I turn it over to, I hope I'm pronouncing it correctly. Is it Shveta Bhaskar? Why don't I turn it over to you for a question that you have?
Yeah, thank you. So my name is Shveta. Thank you everyone for speaking today. Lots of inspirational innovators. I'm a Master of Health Informatics student at the University of Toronto. And I actually referenced Gemini and Signal One in one of my projects recently. So I'm learning about the hype cycle for innovations. And basically what we learned is in the first couple of years, there's a lot of interest and work that goes into innovations. And then let's say like 10 years later, it kind of just dies off because there's so many innovations and it's hard to keep up, or like things change and then your technology or innovation isn't relevant anymore. So I'm just wondering what you do to keep your innovations relevant over a sustained period of time.
Why, thank you for that question. How about I'll just kind of go through the panelists. I don't know, Tomi, you're a serial entrepreneur. This is your 8th company. You probably got some thoughts on that.
Sure. Shveta, you're right that there's fads out there that kind of ebb and flow. For example, cryptocurrency and Web 3.0 is has been fashionable recently in the last few years, but it's now on its downswing. And you've seen a whole bunch of like these types of things go up and down. Even the whole cycle of AI, there used to be a lot of hype, and then these AI winters and hype, etc. So it does take a long time sometimes to, I guess it's important to ride the right wave at the right time. I think that's important. But I think ultimately, like, regardless of what the hype is, and the media often gets it wrong, right? Like ultimately, especially for a clinician or anybody in medicine, you know if you're adding value or you're not, right? Like if you know the patient outcomes are improved, you're saving lives. Those are pretty objective measures of creating value. And so I don't think it necessarily, like in this field of medicine, I don't think the value you're creating doesn't ebb and flow as much as it might in other industries. Things like cryptocurrency, you could argue whether it created any value at all, or whether it was just a vehicle for criminals to siphon money out. The whole field could disappear and the world wouldn't notice. But in the field of medicine, it's it's pretty clear when you're innovating and moving the world forward. However, what's important is that economies change and investors move their focus. So historically, for example, investors haven't really looked at healthcare companies. They know that getting FDA approval or Health Canada approval is a slog. There's misaligned incentives between payers and providers, et cetera. So I would say historically, a lot of health investors may, or like in VCs, may think that it's easier to invest in software companies or apps or cryptocurrency or things that have like unviral fast growth opportunity. And certainly this investment sentiment does change, and that's important for anybody looking at healthcare startups to ensure that the funding sources that you get are from individuals who truly are invested in healthcare and have been invested in healthcare. And usually when you look at funding, you don't just look for the money, you also look at the strategic value they provide and the access that they provide. And I think that becomes very important as you think of like market sentiment for what you're bringing out into the market. But Teodor, you've got years of history, and Kamran, both of you guys have years of history of how you think about funding your business over the long period and kind of riding different waves of interest.
Yeah, absolutely. Tomi, I think what I'm going to do, just because there's a lot we could talk about in terms of fundraising, non-dilutive capital, how you bootstrap when you're getting started. There's probably a lot to talk about there, but I am mindful we have you both for about 7 minutes more, and there are a few other questions. Maybe I'll just go over to the next one, and if time permits, we can, take some of these, or if time doesn't permit, we can take some of these conversations offline. But I'm going to read out one from Michael Lee, which is, each founder has unique expertise in a particular field. What are the top 3 criteria you look for when screening individuals and building a team for roles that may not fall under your area of expertise? So Teodor, since you're dropping off in about 5 minutes, can I direct this question to you, and then we can pick up with some more afterwards?
Yeah, I'm sorry. I need to drop off at 6. I am in New York and trying to execute some deals later tonight. But I'm not sure I completely understand the question. What are we looking for when we say? Let me just see where I can see. Can you?
Yeah, it's in the chat. It's sort of the top criteria for when we're screening individuals and building a team for roles that may not fall under your area of expertise. I think it's kind of, my take on it is, ultimately, you can't be an expert in all of the areas. You're not an expert in, marketing and sales and client success and engineering and all of these areas. But ultimately, how do you build a team
yes, I understand,
is capable of executing on the strategy you have as an organization?
Yeah, I mean, so essentially we're discussing how as a founder and as a leader, how do we judge or assess individuals where we don't have the technical expertise in these particular domains. And actually it's the same process every single time. And since I founded SST, we've invested a very significant amount of time in recruiting the right individuals. I think in these early phases, cultural fit and alignment around the mission and the vision of the company is critical. So I personally spend time with every single recruit, and I still do, when we, regardless of whether it's somebody in marketing, sales, engineering, or accounting. I think understanding what drives them and understanding how they will fit to the existing team, how they will grow and develop, what the expectations are, what their personal qualities are critical. So for me, that's where the entire process starts. Everything else we can teach, everything else are skills that can be developed. But I think especially in mission-driven companies that are founded to change lives or save lives or make an impact in an industry that matters to us, this is a critical component.
Thanks, Teodor. Maybe I'll actually just chime in as well, because I think about this quite a bit in building the leadership team at Blue Dot. And I think first, it's just hire people that are smarter than you. The reality is you can't be the expert in a whole bunch of areas. I'll just, a little anecdote. When I remember when I was starting and thinking about founding Blue Dot, and I was speaking to Rafi Hofstein at the time, who was the CEO of Mars Innovation. And I said, well, what do I know about business? Maybe I need to go get my MBA first. And he said, you don't have time to get your MBA. You're going to get it on the job. And it's going to be far more meaningful than anything you'd learn in a classroom. And so I think that was the beginning for me to just realize I don't need to do all this myself, nor can I possibly do all this myself. I've got to hire people who are smarter than me, who will lead me in their particular area, not be led by me. And then the other part for me is chemistry. Is this a person who is going to stick around and going to be in this when times get tough? Because guaranteed, you will go through tough times. There will be very, very difficult moments. And so is this person okay to be in this, just when times are good, or are they actually someone who really likes tough challenges. And so those are, I think, two criteria for me that I think have been really helpful, to have the right chemistry and just someone who is an absolute expert and who's going to lead you versus be led by you. Because what could I potentially contribute to someone who's an expert in marketing, for instance? That's not my area of expertise. It also lets you, I think, play to your own strengths and not try to do everything else that isn't really aligned with your skills and expertise. So I want to be respectful to the panelists just on time. I know we are at the top of the hour. Why don't we just thank Tomi and Teodor for joining today's discussion. I hope you won't mind if there are some follow-on questions. Maybe we could email you, or just get any thoughts that you might have. Ultimately, this feels like this is really about building a community where we can be sharing experiences, learning from one another, the good, the bad, the ugly, the challenges, celebrating successes and challenges. So really appreciate you both being here. We will stay on for now, and then we'll have a huddle with Ori as to, do we want to continue for a bit or end the session a little bit early today. But Tomi and Teodor, thank you both for joining. Really appreciated all the insights that you brought.
Thank you. And Kamran,
thank you for having us.
I can stay behind to also respond to that question, and then we'll turn it over to Fahad to also respond.
Yeah.
So just with regard to Teodor, nice to see you again. Bye.
Good to see you, Tony, and everybody. Thank you.
So just on team building. So this is both as an investor and as an entrepreneur. I think this is the second most important thing that a founder does. So the first most important thing, of course, is to ensure that you can make payroll. So as a CEO, the number one thing is ensuring that the venture is well funded and there's a sound business model. The second most important thing is to have the right team and the right culture. So that's certainly a lesson that I've learned over the time, and I spent a tremendous amount of time really thinking about the leadership team and who you bring on board. In fact, when I was young, I kind of banked on my computer science chops, and as a technologist, I thought, most of my work was around that. But as you kind of mature and do a few things, I feel like I've become a professional recruiter. So it's like, that's what I do. And that's super important. So the first thing to realize is when you're looking at just starting out and forming the team and thinking about who you want to work with, do realize that it's going to be intense. So just like Fahad said, he and Amol are in a relationship that's very intense, and they lean on each other. They also have to be motivated to show up to work every day and work with each other. And so you have to recognize that a startup is an incredibly testing time. It's trying, and you really you need to lean on your partners to pull you through. Both you need to lean on their expertise. They need to complement you in ways that complement the weaknesses that you have in order for the team to be better. But you also are leaning on each other for emotional support. And that's incredibly important. And it's not to be forgotten that a startup is a difficult, long journey. It is never a straight line. And to have a co-founder or co-founders with you is incredibly helpful for the sustainability of your venture. And that's speaking not just as an entrepreneur, but also as an investor. As an investor, investors will look for teams that are bonded together. And usually a good team is a team where individuals have known each other for a long time. So you just know there's good chemistry between them. I really despise investing in teams that came together because they were in some accelerator or incubator, and they jammed these teams together, and they all they have no history at all together. Those teams also fall apart really fast. So deciding who you go to bed together, which is what a startup is incredibly important. And there needs to be chemistry. There needs to be trust between co-founders. So that's number one. Number two is that the team has to be complementary. it's actually somewhat dangerous to have a partner that's exactly like you. Yes, it might be easy because you think alike, but after a while you kind of realize you don't quite agree on everything. And then when you bring in the same level of expertise, it's really hard to decide, well, what decisions are whose responsibility. It's actually really the best kind of co-founders are ones where it's very clear delineation of their expertise and what they bring and what they own as part of the company. Currently, my co-founder is a former University of Toronto MBA, Rodman School economist and a strategy professor. She ran CDL Health, the CDL Toronto stream. So she is completely complementary to me. I'm the computer scientist and the builder, and she's the strategist and the economist and the thinker. And so it's very clear where we draw the lines. And I think, again, as you think of launching a company, especially if you're trying to launch a company with other clinicians, right? That you need to have the conversation ahead of time on who owns what, and have to be very clear around those tasks. Building a technology foundation is important. Startups are about scaling, and you don't learn scaling in medical school, right? You learn how to one-on-one treat somebody. And so having a team of people that really understand how you bring something to the world is also very, very important. And Kamran, you also asked, well, you mentioned motivation of the individuals. And that's another thing I always ask for as well. The motivations have to be in the right place. If somebody just sees an opportunity that they think is a quick buck, right? This is something that I can do very quickly. That's not the right motivation. You really have to be incredibly passionate about what you do. One of the things I often advise very young entrepreneurs is to ensure that they're working on something they want to work on for the next 7 years. A lot of times people think of, like, they want to be entrepreneurs and they see an opportunity and they think, hey, I can do this really, really fast. And I can kind of like have an exit in a year or two, and this is going to be easy. But it's never easy. It always takes many, many years. So think of like some other startups like Uber. Uber was probably an idea that somebody had, Travis had, while having drinks with his buddies. Hey, let's create a mobile phone app to order limos so we can like show off and party on weekends. We can pull this off in a couple of weekends, right? But look how, and the whole like character of the organization was set up as a quick win, quick path to success. And they never really built the culture to build a sustainable business. And it's taken them years and years and years to actually bring a product successfully to IPO and a profitable, sustainable business. Same with Airbnb, and every single startup I know took much longer than the founders originally thought. And that's where you really have to test people's motivation and ensure that they're working on something they want to work on for the next decade, and that they truly feel passionate about, not just they don't just see it as an opportunity to make riches, but something that they really are drawn to solving. So anyway, so the choice of who you partner with to start a company is an incredibly important decision. There are decisions in startups that are reversible, and there are decisions that aren't reversible. And your co-founder often is not a reversible decision. They own a large part of the equity. They, in many cases, it might just be easier to start over again than start with a foundation that's poorly built. So do take those decisions incredibly seriously. So
Thanks.
Anyway, I just wanted to provide that perspective. I do have to go, so thank you for the opportunity to meet this team. And Ori, I really appreciate you running this program.
Thanks, Tomi, for joining today and for all the valuable perspectives. Really appreciate your time.
Thank you. Have a good night.
You as well. Just was going to pick up on one brief thing that Tomi talked a little bit about in terms of the team building and complementarity. I will say one thing I really learned. I often used to think of the org chart but at one point I had heard from another peer co-founder that think about an accountability chart ultimately, so that you're kind of in this complex dance with others, and the question is, are you going to be stepping on people's toes? What is everyone's mandate? Who's empowered to do what? How are decisions being made, and who's accountable for what? And that really helped shape how I think about a leadership team, so that you've got that complementarity without redundancy or overlap or confusion in terms of who's accountable. I'm just doing a bit of a time check as well. Fahad, was there anything you wanted to add? As I was hearing that, I was just thinking about the challenges you must face, because I remember, there was a point in time, we're about 80 people today, and there was a point in time when, I think when we hit around 50 or so, when I'd sometimes walk in and I was like, hey, who's that? And they're like, oh yeah, they work here. And I realized I didn't have line of sight into everything. And then from a leadership standpoint, it wasn't possible for me to be in all of the details. I had to start to rely on others to, speaking about scale and so forth. And so I was just wondering kind of where you're at, maybe if there's any experience or thoughts you could share with the group just about scaling and building up your team, so that you're not, working every night after dinner till midnight and then starting over again.
Yeah, I'll start by saying that your observation, I've definitely noticed that in the last year or so, that I am not sure what someone's name is. And I am relying on the fact that in the pandemic era with COVID and Zoom calls, you have names labeled, but then you run into someone in real life, and I quickly realize I may not know exactly who someone's name is. So that is a dramatic change than even 2 years ago, where I would know everybody on the team and where they're from and where they went to school and what neighborhood they live in, and kind of the things that I typically ask people that I get to know. And I've also realized in the last year that sometimes people talk about an initiative with an acronym, and I'm not quite sure what the initiative is. And that is also an embarrassing realization, that I don't have as much of an insight into some of the day-to-day operations of what's happening now. Part of that is natural, part of that is the pandemic, part of that is size and growth. Part of that is that many clinicians have been pulled into pandemic-related duties the last couple of years that have kind of pulled time from other areas. So I think all of that is explainable in some ways. Back to the idea of how we've grown. Unlike Teodor and Tomi, we've been forced to grow within an academic institutional model where our salaries cannot compete with TD, for example. And so when you're hiring a data scientist who has a master's or PhD in computer science, we're just not able to compete with what they can be compensated with in industry, or even at a successful and fast-growing healthcare startup where they have a lot of investment funding. And so we've had to take a real heavy stock of what the experience of working on our team would bring to people, and why would it be appealing to someone, even though we live in an expensive city where making 30% more is really valuable, right, for rent and the cost of food and all the other things that have changed. So we really talk a lot about the mission of the work that we do, the transformative aspect, the culture, why it's fun to be part of our team. We've spoken a lot to Ori about the space that our team sits in and how that can be special and make it exciting for people to be there. So we've tried to think about all the things that we can do to make the experience of working with us really great and fun, and make it be something that people want to do for a number of years, while acknowledging that people will often move on. And that's okay. We're catching young, excited people as they come out of school. I hope that we're giving them really good experiences. The people who have left us in the last years have gone on to really great things, have gone on to great jobs in industry, have gone on to great PhD programs at Ivy League schools, have gone on to medical school, even though they have masters or PhDs in computer science. So people have gone on to great things. I think one of the signs that the cultural element is really valuable is that many of the people who leave our group will continue to work with us in some way. They'll come back to us to do projects on the side or work on initiatives or things like that. We see them at social events. So I think that part has been really important to building team culture. In terms of specific characteristics of employees, I have an engineering degree, but that was 20 years ago. And the world has changed so dramatically in terms of the technical skills required to get a lot of these health tech intersection companies or initiatives like Gemini off the ground, that you have to try and get people who have phenomenal skills in those areas and respect that they know a lot more than you do now, and kind of get out of the way. So getting smart people aligning on mission, but then being able to defer and have them kind of course correct as we're growing has been really important. So the growth, the data model, the technical directions, all of that have been areas where I frequently will defer to people because I trust them. They're smart, they believe in the mission, but they know the field a lot better than I do now. And I think that's part of what I'm looking for. The final thing is we talk a lot about our team culture, the hours, all of that when we're hiring people, and we look for people who are excited by that. So we want them, because of what I said in terms of salary and other things, if they're not excited to be there, they're probably not a good fit for us, even if they're impeccably trained. And so a lot of the conversation now in our hiring process is around what their work is going to be like, what the team culture is going to be like, what success looks like for us, and seeing if they're excited by that. The final thing I'll say is that we do panel interviews now. So I think Amal and I learned early on that because we have such a narrow scope as clinicians on this world, that it's important to have a panel as part of the interview process that has different skills than we do and different perspectives. So we intentionally make our panel have gender diversity, skill set diversity, academic training diversity, comp sci engineering, technical skills versus clinical skills. And we try and use that process to have a better sense of what employees will bring and catch the great employees that maybe we would miss with kind of our narrow clinical lens. And that's, I think, considered to be hiring best practices anyway, but it has been really valuable for us as well. And we have hired many people that Amal and I think, would not have recognized their value in that initial interview phase, but have realized over working with them for a year and a half, 2 years, how incredibly valuable they are to what we're doing.
Thanks, Fahad. Maybe I'll just add I know we're trying to, Ori, I know you've got to drop off, so I'm going to just make a couple of comments because I think it's important, just a few perspectives I wanted to share. The way I've thought about recruiting talent is not just about recruitment, but also about retention. And I think about it in terms of multiple currencies. There's some currencies you cannot compete with. You can't compete with a Shopify or an Amazon when it comes to salary, for instance. But culture is an important currency. The ability to learn and to expand your knowledge and evolve in your career path. Having an impact and being able to see and feel that impact and have line of sight to it, and then just feeling that you're part of something that is purposeful. And I think we're seeing a lot of, especially younger folks today, that really want to do things that they feel is that they're contributing to something bigger than themselves. And I think that is an important currency. So, but I do think it's important to not just consider recruitment, but ultimately, how are you retaining people? And I think culture and learning become extremely important in that process. So I'm mindful that we're coming up on time. Ori, I'm not sure if you're still on or if you had to drop off. You're there. What would you suggest? This has been a really, really interesting conversation. I'm sure we could talk further for hours, and there's some additional questions in the channel, but what would you suggest in terms of how we proceed from here?
Thanks, Kamran. First of all, thanks to everyone for coming on and listening to these great talks and answers to questions. A really, really valuable discussion. So I actually have asked Sahar to take the questions that are in the chat. I think, and then what we could do is send them to the panelists, and then the panelists could respond, and then we could just distribute them to all those who attended. I think that would be a very good way of doing it.
That sounds like a great plan. Sahar, does that work?
Sure. So I have the questions down. I think there's just Hussein who said he wanted to speak and ask a question. Could you send it by through chat? Maybe this way we could also have everyone's perspective on that.
While we're doing that, I just want to thank Fahad for joining and coming, like literally, you know, we're talking about going from the bench to, or the bedside to the bench to, in some cases, the boardroom. He's literally doing that right now. And I think also just want to, you know, say thank you, because there's pressures professionally and personally and family. So really, really appreciate your time and just for sharing some of your perspectives today. So thank you, and we'll look forward to seeing you soon. Great. Okay. So I think we've got the question, or Catherine, I think, has put another question. Fahad, if you would like to drop off, feel free. I think we'll follow up with the questions afterwards, but thank you again. Okay.
Bye, everyone.
Bye. So, yep. So I think we've got our game plan. Sahar, if you've got the questions down, we can follow up and then just do this asynchronously. But I wanted to thank everyone else, of course, for joining and taking the time to you know, hear a bit about this discussion. I will say, when I started at St. Mike's, it'll actually be 20 years in just a couple of months. Sort of time flies when you're having fun, I guess. It doesn't feel like 20 years, but there certainly wasn't the same ecosystem. And you know, Tomi talked about kind of emotional support from others. This is a tough path. It is not necessarily a glamorous path. There's often, you know, really, really deep challenges that you go through. And so I think being able to kind of build this ecosystem and a community of people that we can reach out to, talk to, ask questions, because there are playbooks, but I think every company and every venture is different. And sometimes it's just helpful to be able to chat with someone and be like, well, what did you do in this situation? I'm part of a co-founder and founder peer group. And I will say it's incredibly helpful just to hear how others are struggling as well. Not necessarily just hearing about all the successes, but just like, gosh, like life is difficult personally, professionally, the company's struggling. It's really helpful to be able to kind of share some of those experiences and support one another. So hopefully this process here is part of building that community and that ecosystem, not just of, you know, funding and financing and AI and so forth, but actually an ecosystem of people and a community. So maybe I'll turn it over to Sahar and Ori with any final words, and we can wrap up.
No final words beyond thanking everybody, and have a great evening, and we'll get back to you with some of the responses to the questions you had. Really appreciate it. Thanks, Kamran.
Okay.
Outstanding job.
My pleasure. Okay, thank you, Sahar.
Thanks, Sahar, for organizing.
Good night, everyone.
You're most welcome. Have a good night, everybody.
Thank you.